Our next speaker is a leader who blends compassion with action in the world of healthcare. Dr. Jillian Zambon is a healthcare executive with a track record of impact at institutions like Dartmouth, Fresno, and Mercy Hospital. As a U.S. Navy veteran and a doctor of education and organizational leadership, she brings a powerful perspective to how systems and people can heal. Beyond her impressive credentials in healthcare, IT, and administration, Dr. Zambon is a two-time best-selling author, the Season 6 winner of The Blocks, and a passionate advocate for mental health work through her work with the Wayno Foundation. Today, she invites us to reimagine healthcare through the lens of resilience and empathy. Please welcome to the Tulane TEDx stage, Dr. Jillian Zambon.
Have you ever had a gut feeling that something wasn't right, but everyone around you dismissed it? Maybe it was a relationship you were in. You knew you should leave, but still, you stayed. Maybe it was a job that drained you, but you convinced yourself it was just work stress. Or maybe, just maybe, it was a health issue. A moment where your body was telling you something isn't right. But the experts, the doctors, and the textbooks all told you, it's nothing. Today, I want to tell you about a time that brought me to uncharted territory. The unknown experience of having to advocate for myself as a patient. I had spent years studying medicine, working with patients, and trusting the system I was trained in. But suddenly, I found myself on the other side of the table, where my medical expertise clashed with my personal uncertainty. And in that moment, I realized something profound. Without our health, what do we have? We can't enjoy time with friends and family. We can't celebrate life's milestones. We can't even savor the small, everyday joys of life. But too often, our health, our very survival, is determined by what someone else has read in a textbook. A diagnosis built on elimination, numbers, and statistics. But what about the things that can't be measured? What about the invisible warning signs? What about our own intuition? Because sometimes the most powerful voice in the room isn't the one in the white jacket. Sometimes it's the one inside you. A couple of years ago, I started feeling off. It wasn't anything dramatic. No sudden collapses, no glaring red flags, just small persistent signals from my body. I was gaining weight for no reason. I felt exhausted, even after a full night's rest. And deep down, I knew something wasn't right. So I did what we're all told to do. I went to my doctor, expecting answers. Instead, I get a phrase that many of us have heard. I'm sure it's nothing. Now, let's pause here. This was a doctor, a trained professional, someone whose job it is to listen, to diagnose, and to treat. And here I was, just a patient with a feeling. I almost walked away. I almost believed her. But something inside me refused to let go. So I pushed. I asked for more tests. And finally, she ordered an ultrasound. And that is when everything changed. The doctor who had at one point dismissed me now sounded alarmed. We found something abnormal, she said. You're high risk for premature ovarian failure. We need to get you in to see a specialist immediately. Panic set in. Premature ovarian failure? Did that mean I couldn't have any more kids? An ovarian abnormality? Was it cancer? I'm a single mom. Who's going to take care of my daughter if something happens to me? I hung up the phone without asking a single question and burst into tears. My daughter found me in the hallway, wrapped her little arms around me, and said, "Mommy, are you okay?" I told her something might be wrong, but I didn't want to worry her. And then I focused. I had to get answers. But when I finally saw the specialist, my overwhelming fear was met with a complete opposite reaction. It's probably benign. Nothing to worry about, she said. Wait, what? One doctor was overplaying it, the other was underplaying it. Who do you trust when the experts don't even agree? It was that moment that shattered my faith in the system I was trained in. Two highly trained doctors, two very different conclusions, and caught in the middle, me, the patient, stuck in uncertainty. I had to decide. Do I get another opinion? Do I get another test? Do I go see someone else? Ultimately, I decided to advocate for myself. I demanded a biopsy. Excuse me. The specialist resisted, saying it was unnecessary. But I didn't care. I needed to know. I needed to be here for my daughter. When the results came back, it was negative, but I have no regrets. I learned that I'm high risk for ovarian cancer. I learned that the standard 3 to 5 year screenings aren't enough for me. And I learned that if I want the care I need, I have to fight for it. But what about the people who don't have the confidence to fight for it? What about patients who walk away with false reassurance? Or worse, what about people living with unnecessary fear due to an overblown diagnosis? Had I ignored my intuition, had I just accepted what I was told, I could have been facing a life-threatening situation. And that's why I tell you this story. Because if this could happen to me, a doctor trained in this very system, what does that mean for everyone else? Let me tell you about Sharon. Sharon was just like you, just like me, a mom, a career professional, someone who always put others first. She had spent years balancing career and family, and just when things should have slowed down, she was stepping into a new role, a grandmother. And then one day she felt a nagging pain in her shoulder. She went to her doctor, expecting answers. It's just a pulled muscle, they said. There's nothing to worry about. But the pain didn't go away. It continued to get worse. She kept going back, searching for answers. Each time she got the same response. Just do some physical therapy, try rubbing your shoulder on the doorway. The pain continued to get worse until she couldn't even walk, and her son had to carry her, until even that became too painful. For over a year, she pleaded for someone to listen to her. When they finally got her in to see the specialist, it was too late. It wasn't a pulled muscle, it was cancer, and she had only months to live. Sharon was just like the rest of us. She expected the experts had her best interests at heart. But when the hospital realized she was dying, they discharged her. Not to help her, but to protect their scores. If you've never heard of hospital scores, let me explain. Hospitals are paid by insurance companies, Medicare and Medicaid, based on quality metrics, patient satisfaction, and readmission rates. Every number matters in how they will get paid. So what does a hospital do with a patient like Sharon who's dying due to medical misdiagnosis? They get them out. They discharge them before an infection, a fall, or worst of all, a death on the record impacts their bottom line. And that's exactly what they did with Sharon. They knew she was going to die, and they made her leave. Every year, nearly 800,000 patients in the US alone suffer death or permanent disability due to diagnostic errors. That's 800,000 people whose pain was ignored. 800,000 people who were told it's nothing. 800,000 families left wondering, what if someone had just listened? Sharon didn't know what questions to ask. She didn't know how to fight for herself. But what if she had? I'm not saying that doctors don't care. They do. They sacrifice. They work tirelessly. They want to help. But the system is built for speed, not listening. The average doctor's appointment lasts 15 minutes. Physicians can see up to 40 patients a day. They rely on textbook cases, not individual experience. And the result? People like Sharon, people like me, people like you, we all suffer. It's time we learn how to advocate for ourselves before it's too late. So how do we do that? First, Listen to your body. Your body is constantly speaking to you. Symptoms aren't always dramatic. Sometimes they're very subtle. Pay attention to them. Second, ask questions and demand tests. If a doctor dismisses you, push back. Ask, can we rule out something more serious? What else could this be? Third, get a second opinion. Medicine isn't black and white, it's interpretation. One doctor's opinion isn't final. Fourth, leverage resources. Download symptom trackers. Join patient advocacy groups. Empower yourself. Healthcare needs a shift. We are not just passive recipients of care, we are partners in our own health. Doctors have expertise, patients have experience, and real medicine happens when both are respected. So I leave you with this. Listen to your gut. Ask questions even when it's uncomfortable. I know it's easy to trust your doctor. You want to. After all, they're the experts. But experts can make mistakes too. The system isn't perfect, and only you truly know what's happening inside your body. If a doctor dismisses you, push back. If you're told it's nothing, ask again. Because no textbook, no system, no doctor knows your body better than you. Advocate for yourself. Fight for yourself, because your life depends on it. Thank you.
Hello. Hi, thank you guys so much for coming. I would like to invite all the speakers back up onto the stage. We have a little something for you, and I would like everyone to stand up and give them another round of applause. All of our speakers up here on this stage put hours of work into crafting, memorizing, practicing their speeches, and so I just want all of them to know that we are so proud of them, and if we can, they can all take one more big bow. And want to shout out the amazing TEDx team, all of us over here who spent lots of hours also working on this event. And to thank you guys all so much for coming. There's more food outside. Please take some on your way out. And speakers, please stay around for a second. Yay!
We're trying to share that what's for the video. No, stop. That's fine. I'm seeing. So,
Our next speaker has spent over 2 decades at the forefront of bariatric medicine, transforming not just bodies, but lives. Dr. Nate Nicholson is the founder of the Nicholson Clinic for Weight Loss Surgery, a nationally renowned center that has cared for more than 25,000 patients in 50 states and beyond. As a surgeon, an author, and an educator, he's known for pairing advanced medical innovation with a deeply human approach to care. Today, he's here to pull back the curtain on topics surrounded by hype, hope, and misunderstanding, the hidden realities of weight loss medication. Please join me in welcoming Nick Nicholson.
Thank y'all for having me. I got a lot to cover and only got 10 minutes, so bear with me. I want to talk about a topic that's all over the media these days, both nationally and internationally, and that's these amazing weight loss medications on the market, these GLP-1 drugs that are taking the nation by storm, if you will. I mean, do they have some amazing results? Yes. Do they have some not so amazing results? Also, yes. But the problem is that there's been a lot of talk about providing mandatory coverage for these drugs in the US, and I'm here to tell you, left unchecked at the current costs, those drugs will single-handedly bankrupt our healthcare system in less than 2 years, okay? Their costs at present are simply not sustainable. And they're not this panacea for all that is weight loss the way that they're being portrayed in the media. Good evening. As they said, my name's Nick Nicholson. I'm a weight loss surgeon from Dallas, and I've been practicing weight loss surgery and obesity medicine for a little over 24 years. And during that time period, I've seen some amazing things. Man, I've seen marriages happen. I've seen children born to otherwise infertile parents. I've seen joy. I've seen heartbreak. I've seen failures. I've seen complications. I mean, the whole gamut. And over that time period, a couple of things have become very obvious to me. Number one, the obesity epidemic in America is doing nothing but worsening. At present, 1 out of every 3 people in this country is obese. And number two, the cost of treating that obesity is breaking our healthcare system, which really brings me to the topic of my talk. And certainly while cost is an overarching theme, given the specific focus of this talk, what we're going to examine tonight is, are these drugs worth the cost? Are they really effective? And how do they compare to the most effective treatment we have, which is surgery? Well, if you look at the data, you'll find out that last year alone, the U.S. spent $173 billion on obesity alone. Okay, and no one needs to be told this next part, but over the last 20 years, insurance premiums have tripled. Okay, and a large portion of that is due to the cost of treating obesity. Now, fortunately, when it comes to treating obesity, we have the 2 most powerful weapons in our armamentarium that we've had in the history of modern medicine. We have GLP-1 medications and we have weight loss surgery. Okay, but is there a time and a place for each of these? Certainly, depending on the patient's journey and where they are. But when we compare these, we've got to keep our eye on the prize, because what's the ultimate goal here? Significant, long-term, sustained weight loss. Okay, listen, losing 50 pounds just to gain back 60 is not success. Okay, so to that end, I'd like to share a case study with you wherein both of these options had a very appropriate place in this patient's weight loss journey. Okay, then we're going to talk about how they actually played out within the confines of our healthcare system. So Sarah is a 32-year-old patient whose name has obviously been changed for confidentiality purposes. And before we go into that, though, let me talk to you a little bit about what Sarah went through before she showed up in my office. See, Sarah, like many patients, she'd been overweight since childhood. I mean, her parents had put her on dozens of diets. She'd tried exercise. She still got made fun of as a teenager. She still felt marginalized. She really wasn't in the relationship she wanted to be in. She wasn't wearing the clothes she wanted to wear. She'd gotten to the point where she felt that her obesity, her disease, was holding her back in her life. Okay, see, this is much worse than just, I'm overweight, now I've developed diabetes. No, this is a very personal and very emotional experience for patients. So understanding that, Sarah's 5'5", she weighed 215 pounds, she had high blood pressure that was controlled with one medication. So her primary care doctor put her on a GLP-1 drug that her insurance covered. Important point. Okay, how'd she do? Man, she did great. She lost 39 pounds in 9 months. Blood pressure was down to normal with no medications. Then her insurance changed. That drug was no longer covered. How much did it cost? $1,300 a month. She couldn't afford that. She couldn't afford the generic version either. So what happened? Well, Sarah got to find out the hard way that 2 out of every 3 patients that stopped their GLP-1s regain all of their weight within 1 year. Sarah was no different. She didn't gain to 215. She went past that up to 222. Again, common story. Had high blood pressure again. What do we do now? Well, fortunately, Sarah was able to have weight loss surgery. She lost 53 pounds in a year. Blood pressure was back to normal. Okay? See, this illustrates to me the biggest hurdle that we face in treating obesity in Western society, and that's cost. Cost is crippling us. Okay? So looking at Sarah's case from a cost standpoint, see, Sarah likely never would have needed any further intervention if she'd been able to continue those medications. See, but that's a huge limitation of these drugs. They're lifelong, okay? They're not a cure for obesity. They're a tool for treating obesity, but it's no different than a patient with high blood pressure. Hey, take your blood pressure medicine today, your blood pressure is normal. Don't take it tomorrow, guess what? You got high blood pressure, okay? So in Sarah's case, had she paid cash for this, she would have had to pay $15,600 per year, potentially forever, to continue her admittedly highly effective medication. And now for those of you that go, no, Sarah wouldn't have paid that, her insurance would have paid that. No, the healthcare system as a whole would have paid $15,600 for that. Rest assured, someone would have been paying that drug company $1,300 a month for her treatment. Okay? Now, in this case, fortunately, she was able to pay $10,000 once to have weight loss surgery and no ongoing costs from that. See, this illustrates the Achilles heel of these drugs right now. Exorbitant cost. These drugs are still under patent. So let's go back to that concept of mandatory coverage for these. All right, listen, if we put the 1 out of every 3 Americans that has this disease on those drugs at those costs, that would cost an extra $1.73 trillion per year. Okay, compare that to last year's entire healthcare spend of $4.9 trillion. That increases that by 35% every year. That's not sustainable. Okay, and even if it was, are these drugs worth the price? Okay, think about it. GLP-1 drugs increase a hormone in the body, strangely called GLP-1. And from an oversimplified standpoint, higher levels of GLP-1 in the blood decrease your appetite and they help you lose weight through a variety of mechanisms. But if we compare this to other more effective treatments like surgery, what do we find? Well, surgery actually increases GLP-1 levels 3 times more than any GLP-1 medication does. And surgery actually outperforms GLP-1s across the board. I mean, better overall weight loss, long-term sustainability, less side effects, lower costs. And then we got to stop and think, look, these things are everywhere. And we've got all these celebrity endorsers. We got these cute commercials where everybody bursts into dancing in the middle of the street because who doesn't enjoy getting a good injection? All right? They don't show you the truth. All right? What's the truth? 58% of people that start GLP-1 drugs stop them in less than 12 weeks. That's right, less than 3 months. And they don't work at all for 20% of people. Okay? You're not going to see that on one of those commercials because that's not sexy. But that, ladies and gentlemen, is reality with these medications. So what's this mean from a financial standpoint? Well, I mean, GLP-1 drugs, if you choose those, you're locked in. I mean, these drugs are a lifelong treatment, okay? You know, that's why so many people are exploring surgery these days. Now, are they a big deal? Yes, they're a big deal because they got big pharma dollars behind them, but they're not the most effective treatment we have. Surgery's more effective and it costs less. It just doesn't have big pharma dollars. Okay, but despite the media blitz and all the celebrity endorsers, GLP-1s are not a solution for the average American, okay? They're a short-term fix, they're a Band-Aid, all right? The bottom line is these drugs are not financially accessible to the average American when you take them in the context of them being a lifelong treatment. Okay, now I'm not sitting here saying that surgery is the answer for everyone because it's not. Okay, but what I am saying is GLP-1 drugs, they're not the answer in their current iteration either. All right? Now, I'm certainly not professing to have all the answers, but the first thing we do in medicine, identify the problem. And once we've identified it, what are we going to do about it? Well, listen, I'm here to tell you, it's going to take a Herculean effort. I'm talking money, time, compassion, research, everything. But the very first thing we have to do to tackle this disease, we have to destigmatize obesity. We got to quit marginalizing obese patients. We got to look at this more like it's depression or breast cancer. You know, maybe then people wouldn't be embarrassed to seek help. Okay, maybe if they felt like everyone was pulling for them, like we do when we hear someone has breast cancer, maybe that would be a little different environment and something that could start that process. Now, I know that's a lot to ask, but listen, this journey of 1,000 miles, it's got to start somewhere. So, thank you very much for having me.